It's easy to use words like reimagine and reconstruct and so on, but we all know that where we stand right now, for many of us, it's hard to take our eyes off the urgent priorities, the uncertainties that we see confronting us, whether it's finances or the communities and causes that we serve or the well-being of our staff. It's appropriate, however, to remember the Chinese ideogram for crisis, which actually contains two elements, the element of danger and the element of opportunity. We're certainly not lacking for crises right now. We've got certainly COVID-19 right on our doorsteps, but looming behind it is an economic recession and, of course, the ongoing threat of climate change that threatens our very existence. Some changes have just been forced upon us and we've had no choice but to reinvent. One of those is the work from home or the shelter in place, whatever it's called in your organization. We've had to reconfigure our ways of working and most of us have found some way to do that. The other change that's been forced upon us is digital transformation. So those of us that have been dragging our feet for the longest time saying we intend to get around to this, but we haven't actually started doing anything about it, have suddenly had to accelerate and jump in at the deep end. Some of those changes are trends that have been coming for some time, and what the crisis is doing is accelerating them. So we know already that employees today are not employees from 50 years ago. They are not command and control structure based people that operate in these very rigid frameworks. That evolution, thanks to work from home, thanks to digital transformation, is getting accelerated. And every organization I've seen that has been at the forefront in terms of agility of response, one of the common factors across all those organizations has been a culture of trust, of autonomy at the front lines, and of collaboration. Another change that many of us have had to grapple with that has been forced upon us in some ways, or that we have opportunistically seized, is the opportunity to ally with unusual allies. So people who have never worked with government, who have been fierce critics of government, find themselves in close partnerships with government. Corporates that are deeply competitive with each other are finding themselves collaborating on a scale that they've never seen before. While we're thinking of unusual faces and unusual names, we have the opportunity, I think, to also look inward and look at the altogether two usual faces that we're seeing on our boards and in our leadership teams. We urgently need to think about reinventing our governance structures to reflect the communities that we work with. Shifting our gaze, if you will, from the internal of technology, people, governance, to the external and the policy space out there. One of the things that any crisis does is widen the aperture, if you will, of what is acceptable by way of policy. So for example, are we going to really go back to breathing that unbreathable air that we were breathing 6 months ago? Or have we shifted to a normal where we will insist that we take stronger action against climate change? As we start to flatten the curve of the virus and the pandemic, can we consider what other curves are open to flattening? Can we be looking at, for example, a reimagination of how business works and its responsibilities, taking it away from this narrow box of CSR that we have plonked it down into and looking at the whole spectrum of what business is about? I think when the Financial Times says that capitalism is ready for a reset, we can sort of assume that this is now acceptable policy debate and not just the voices of a few loony left radicals. Similarly, when the Economic and Political Weekly and Swarajya and everybody in between agrees that universal basic income is an idea whose time has come, perhaps it is in fact an idea that is ready to roll out and not something that we're going to spend the next decade debating the finer points of. I could go on and on. There's a whole vista of policy areas that we now have the opportunity or we have leverage to make radical change in. So they're the obvious ones, the ones that are confronting us starkly in the face. Things like public health or labor rights or public housing. But also the less obvious ones, non-profit regulations, the non-profit ecosystem, how we measure our success as an economy and as a society, gender roles, and so on. McKinsey says that philanthropy is changing and that philanthropic norms are changing. We've seen across the world over 1,000 donors take pledges to reduce the burden of reporting on their grantees, to become more flexible, to start paying what it takes and not just paying for program costs. So is this an opportunity here as well? A few donors in India have signed those pledges. Can we get those donors to shift the norm for their peers? Can we forever forget about the ridiculous overhead ratio? Can we just put paid to that forever? Given the new appreciation among donors of what it actually takes to build and run a nonprofit program, can we finally get donors to actually stop talking about line item accountability in budgets? There's a boom in impact capital for social causes of all kinds. There's a whole spectrum of social impact capital opening up there, including this new social stock exchange that is being proposed. Do we have it in us to rethink our business models to be able to attract some of these new pools of capital? A couple of months ago, many of us were shocked to receive letters from the Home Ministry and Niti Aayog addressing us as dear friend, terms of endearment that we've never heard from a government authority. What are the opportunities that this newfound respect, or at least this newfound acknowledgement of the value of nonprofits has? In a situation particularly where we know that we're looking at losing maybe a decade of progress on the SDGs. Is the window finally open to actually get the budget allocations for education and health that have been promised for 40 years but are yet to be realized? Given the stark reality that elites, middle-class people, urban people in our country suddenly discovered the chain that links them inextricably to people who are normally invisible to them, and that the reason what they see at the tip of the iceberg, the woman that comes to cook their food, what it takes and what her life circumstances are that get her there and what she copes with. Is there an opportunity finally to start getting funding for the root causes of these problems rather than sort of to go upstream, if you will, when it comes to funders? And finally, as a sector, do we have now the will and the desire to build for ourselves the ecosystem that we deserve? The networks that allow us a voice in policy discourse, that allow us to build an evidence base for our advocacy, and that can collectively advance the interests of the sector. In every country around the world, young people have got it, and they're showing us the way. It's up to us really to figure out whether in fact we have the vision and the will to seize some of these opportunities for radical reimagination. I have the pleasure now of convening a panel of people that have used this crisis to do exactly this, to reimagine the possibilities that are open to them and the communities that they serve. I'm going to introduce them to you briefly. Most of them are so well known that they scarcely need an introduction. Ashif Shaikh is founder director of Sahas, which works with socially excluded communities, especially women and girls, but Dalits and people who work in manual scavenging that protects their rights. They have been at the forefront really of putting the issue of migrant workers on the radar of the government and of funders. Bharath is the director investments at Omidyar Networks India. And Omidyar was among the first responders when it came to creating this rapid response fund, as well as signing the donor pledge, or almost initiating the donor pledge. And the person I'm going to start with really is Archana Chandra. Archana is CEO of one of the largest and oldest nonprofits serving intellectually challenged children based here in Mumbai. So Archana, Vakeel's response to this crisis has been, I think, utterly remarkable in multiple ways. It's been remarkable in its comprehensiveness. You serve a community of children whose needs are significantly more intense and significantly wider than just the average kid. Parents on this webinar today will know that it's been hard enough to manage situations at home with kids who've been away from school for all this time. The parents of the children you serve have multiple issues. Not only do their children have much greater needs, but they come from economic circumstances that limit what they can and cannot do. So you guys have provided that community with food, with cash, with digital content, with counseling, with well-being in a variety of ways. And you've covered the students themselves, their parents, your staff, and communities surrounding them. What do you think, Archana, that allowed you this kind of response?
Thank you, Ingrid, for your very warm introduction. And I have to say, I absolutely loved your presentation, right? We have to all learn how to make such colorful slides that captivate people's interest.
Thank you.
So I think, Ingrid, my journey at Vakeel began almost 12 years ago, but it is only in 2013 when I took on the leadership role. And honestly, at that time, for us, corpus was a luxury. It was almost a dream, right? What we did know was that we had to build both organizational as well as financial resilience for the organization. Honestly, at that time, there were months when we were struggling to even pay salaries. And so we knew that we had to make some very difficult but strategic decisions for the organization's long-term resilience. So we actually wound down a lot of the non-core verticals that we were running and focused a lot more on our core programs. Apart from that, when we started going out and raising money, talking to funders and donors, we were very honest and candid in our conversations, where we said, yes, we definitely need OPEX on an annual basis, but can you please give us a percentage of this funding in order to put away to corpus in order to build long-term resilience. We were almost fanatical about this, right? Because this was a goal that we had set for ourselves to build out the corpus. And honestly, no amount was too small. Even 5,000 rupees if someone was giving, we were standing there with a corpus letter. Last year in 2019, we celebrated our 75th anniversary. And again, we used this platform to actually, we envisioned a really different project called Champions of Change, where the objective was twofold: to spread awareness about the work that we do, as well as to build towards corpus. So at the end of the initiative, we had about 101 donors who had pledged a certain amount towards corpus. So I think now, 7 years later, our corpus has increased about 4 times, and we have the cash flows to look after our expenses for nearly 2 years. But this was something that didn't happen overnight. Like I said, we were fanatical. It was a goal that we put forward for ourselves, and we worked towards it over 7 years. So that is in terms of financial resilience. And the other thing that we again very consciously did was the organizational resilience. So what do I mean over here? 2013, for 69 years, the founding family had done the most amazing work through Vakeel. But we found that there was a little over-dependence on the leader or the founder. So again, the goal for us was to build organizational resilience. And today we have a really strong 10-member leadership team. About 40% of the team is in a voluntary capacity. So the fringe benefit is that we save expenses to the tune of about 7%. Like I said, we're just anal about costs. And that has also really helped. What we've done is we've also consciously built out strategic relationships with people who just want to serve. So we have supporters, volunteers, the advisors, all of them have been an integral part of our journey. And honestly, so for example, Dr. Anita Hegde, she's a pediatric neurologist, and she's been so wonderful when we had to figure out our digital content library. Or Sandeep Bhandarkar, who helps us as an advisor to look at all our strategic initiatives. And I think having people like this to talk to bounce off ideas has been almost invaluable with regard to responding and repurposing at a time of a crisis like this.
How is the experience of responding to the crisis shaping your plans for the future? What have you done now that you think has fundamentally in some ways altered the trajectory of Vakeel going forward?
Sure. So I'm going to just take this question in two parts. So the first part would be, what did we do or what are we doing with the kids who are on our campus, or direct intervention, if you may. And we have about 700 kids that we work with on a direct basis. 40% of them are from the lower socioeconomic strata. So like you and so many others, I heard through the findings from the questions that Vikram shared. For us also, the month of March, when the lockdown kicked in, was basically a time of just touching base with our staff, with our kids, with their families. And the questions we just asked was, are you safe? Are you okay? Is there enough food on your table? Do the children have medications? Because neurological drugs cannot be stopped. So I think that was the question. Immediate relief came in the form of about 350 odd grocery kits for families, medicine kits for the kids, etc. So that was March. Come April, when we were talking to the parents, a lot of them started saying, all is okay in terms of we're safe, we're home, etc. But our kids are getting very irritable. We're having behavior issues. By the evening, the child wants to go out. They don't listen. Can you help create some sort of a structured timetable for our kids at home? So that's when, we sat with Anita Hegde, as well as lots of other smaller groups with parents and specialists. And we said, why don't we build out some sort of a online resource material that our parents can use? This was no easy task, right, Ingrid? Because some of our teachers were stuck in their villages, limited bandwidth, no teaching learning material at home, etc. So very quickly we gave them very simple guidelines on how to make these videos to work with the kids. The idea was familiar voice, familiar content, familiar face, right? And I think our teachers were just amazing, because literally in a month, we had about 140 videos that they churned out, all homegrown, some from villages, across 13 different playlists. So these playlists included things like, what can the child do for activities of daily living, for dance, for music. And we encourage the family to do dance, as a whole in the evenings and things like that. So this is what we did in April. 30th April, we officially launched our digital content library on YouTube. And I think we have about 1 lakh views already on that. Then somewhere towards mid-May, we started saying, I don't know when this is going away, and which basically means we don't know when our kids are going to be able to come back to campus. Because Ingrid, apart from IDD, they also have a lot of other underlying comorbidities, right? Like a weak heart, respiratory issues, hypertension, etc. So we knew that they were not coming back in a hurry. Also, because of their limitations with understanding things, they do not really understand social distancing. A child with autism is not keeping that mask on their face for 2 minutes, let alone 5 hours. So we knew we had to put a greater fight in what online education meant for us. So I think the month of May was put in that, as well as early June was all about training. 22nd June, we went live with our online education. It was a blended model of online Zoom classes, as well as a lot of support staff going back and calls being made. And here, the videos that we had made in the digital content library were now used to supplement concepts that were being taught. And here, of course, tech continued to be a challenge for us, because it was one thing for the teachers to make one video on their phones, but it was totally different in terms of running online classes. So we just kind of said, we'll do whatever it takes. No child left behind. So let's just embrace technology. So we gave teachers dongles, some of the kids got smartphones, and we gave a lot of the kids data recharge cards, which enable them to continue doing this. Now, when we thought about it, we've reached July. So early July, we started talking about what does the future of the digital content library now look like for us. So again, we've been relying very heavily here on small group conversations as well as data. We did a survey recently, and of the 350 kids in school, about 220 parents replied that 41% of them are seeing some video or the other on a daily basis. So we know we need to build this out, right? But the shape and form that we had built it out in April may or may not be applicable for us going forward. So what does it look like? So again, when we looked at the responses, we found that music, dance, and the healthcare videos were actually right on top. And the academics was really not cutting it. So going forward, we're saying, we're going to build this digital content library out. We're not going to build academics. We are going to have one stream, which is going to be for curriculum. So these videos will continue to support the curriculum that we're using. But the second piece is going to be like a one-stop shop that parents can use with their kids in the evenings, over weekends, summer breaks, etc. Here we're going to partner with specialists like a Shamak for dance, or a Priyanka Pandit for music, or an Umayo Sports for sports, so that we have partners bringing in their expertise, and we just become the people who put it all together, and therefore all the videos will have a similar look and feel. So that's what we've done on that front. And the second part to this was the kids that we were supposed to reach out through our scaling model, because we have a partnership with the government of Maharashtra, where we were supposed to roll out the curriculum that Vakeel has built for special needs across 36 districts, I think 275 schools, 1,300 teachers, 13,000 kids. So honestly, somewhere in, again, the end of May and June, we sat down and said, oh my God, the training that was supposed to happen in April clearly couldn't have happened. So we're going to have to reimagine what this training is going to look like, because all these schools are depending on us. So again, put together a lot of material that we already had, but took it on the digital platform, used a lot of the videos that we had made, again, on the digital content library to supplement the trainings over here. And we were able to complete it as of literally last Friday. So now when we're looking at this digital content library, we're saying in its new avatar that we're going to build out, we would love for this to be actually bundled with the curriculum when we take it out.
I'm going to move now to Bharath. Bharath, ON India was, as I said, one of the first funding organizations to sign that pledge about grant making less onerous, essentially. But also you launched this rapid response fund for organizations directly working on COVID relief. Two questions really for you. What do you see as the opportunities out there for transformational change? A lot of the organizations you work with work in governance, in access to justice, in areas that are very, very far upstream. What do you see as the possibilities for transformational change at that level is question one. And how is your experience through the crisis really shaping your plans for the post-pandemic scenario?
Sure. Thanks, Ingrid. And thanks so much, first of all, for having me. It's great to be with such an amazing group of people here. And wonderfully inspiring to hear Archana and all of the things that she's been doing. Happy to talk about both of those things, Ingrid. So first, in terms of the opportunities that we are seeing, I think some of the themes that have been touched upon by yourself, by Archana, I think certainly resonate in some of what we are seeing as well. Right? So I think there's probably 2 or 3 categories of opportunities that we are seeing coming up. I think first, the one that has been touched upon quite a bit is just technology-driven model. That's something that we tend to focus on quite a bit as Omidyar Network to begin with, even pre-pandemic. We'd always been emphasizing the need for technology because it's something that we believe can scale reasonably cost-effectively and to bring things to population scale in a way that is pretty hard to do without leveraging technology. It's something that we had always been emphasizing even pre-pandemic, but I think it's come into focus a lot more post-pandemic because I think that's the general direction that things have taken after the pandemic. And so certainly anything that includes a fairly large reliance on technology is something that we've seen actually scaling more rapidly post-pandemic than they were before. So I can talk about a couple of examples of some of the partner organizations that we work with. The first is this organization called the E-Governments Foundation, which essentially does what you can think of as an ERP platform for cities. So this is essentially saying for all of the cities and towns, and there are about 4,000 of these that are called urban local bodies across our country. So it's a fairly large group of entities. And for each of these, essentially what they do is to build a technology platform to help enable all of the different activities that municipality runs. So all the way from issuing birth and death certificates to collecting property taxes and so on. So one of the clear shifts that's happened for them post-pandemic is a deep interest from government in saying, how can we actually leverage technology a lot better? So a lot more states starting to approach them, a lot more states starting to say, we need to be using this technology within our operations. So for example, for collecting property taxes from citizens, something that in the past you might have relied on citizens sort of showing up at an office somewhere and standing in line to pay those property taxes. It's clearly something that needs to shift instantly to a digital platform, right? I mean, how many of us pay our mobile phone bills by standing at an office somewhere anymore? So it's the kind of thing that obviously needs to leverage technology. And I think it's something that we've seen sort of a fairly rapid shift happen over the last few months to a point now where about 1,700 or so urban local bodies across the country are already on eGov's platform at various stages of implementation. Many of them already online, some of them going online fairly soon. With a line of sight to about 2,000 in the next few months and hope fairly soon, all 3,500, 4,000 or so urban local bodies across the country. So that's sort of one big example. I think another is something that we are seeing in our access to justice work, where again, our courts have been for a number of years now adopting more and more technology and starting to take various aspects of their work online. And that's something, again, we've seen accelerate pretty dramatically over the last few months. So Justice Chandra, he's the person in the Supreme Court who heads their E-committee and is therefore responsible for all of the technology implementation that the courts do. And he's gone on record publicly talking about the need for much deeper use of technology by the courts. The fact that he wants to be thinking of justice not as a place you have to go to, but actually justice as a service, right? So not something that's tied into the concept of a court, but something where you can actually seek justice no matter where you are. And that requires deep use of technology. And therefore, Justice Chandrachud has been talking a lot about just the need for open APIs and other sort of elements of technology like that. So I think this is, again, something that we could not have foreseen even a few months back. And the fact that this has happened at such a quick pace is quite amazing. And I think for most of you in the group today, the lesson it probably holds is that there are those types of opportunities in places where you might have thought that it's going to take several years for this sort of change to occur. I think you might be surprised by the pace at which that change is starting to happen now. And so go out there with your boldest ideas. They might just click, right? Because there are probably people feeling desperate for ideas now of how they can leverage tech. And if you have interesting ideas, then I think the likelihood that those will resonate in this environment in particular, I think have sort of grown manifold. So that's, I think, one sort of big category that we are seeing, places that leverage technology in a big way. The second is that we are starting to see a particular focus emerge on specific communities that have been most hard hit by the COVID crisis itself. Right? So in our work itself, we've started to focus a lot on issues of migrants and MSMEs in particular, because we found that these are two particular groups or communities that have been very hard hit by the crisis. And so I think for those of you who are focused on communities that have become even more vulnerable as a result of the crisis, I think it could throw up an important opportunity to be able to sort of highlight in what ways the lot of that community has become a lot worse. I think you'll start to get the attention of funders and people in the community in a much more rapid manner than you might have been able to before. So I think it could be helpful to really think sharply about what communities we are serving and how they have been particularly impacted by the crisis. And so that could be sort of a second bucket of opportunity. And it's certainly something we are very focused on as a funder. I think the third could be sort of specific problems or issues which might have not been particularly sort of at the forefront in the past, but which could have come into a lot more focus just now. So I'll take the example of urban reform as one such thing, right? I mean, it's a bit of a pet peeve of ours, given the fact that we as a funder focus a lot on the issue of urban governance. The fact that there isn't a lot of focus that's put on that issue, right? And but during the course of the crisis, I think one thing that we've seen, and it sort of came out of left field, but there was a lot of painstaking work done by organizations like Janagraha that had essentially focused on saying, what is it that we can do to hasten urban transformation? And so there was a lot of focus, for example, on this issue of municipal finances. Again, a very sort of boring topic, but something without which we believe that, not a lot of sort of lasting change can happen in urban contexts. And again, it's sort of, it's been a topic on which progress has been very hard. Janagraha has probably been focused here for about 10 years. But I think that the crisis has sort of speeded up focus on a specific issue like this in a way that we might not have been able to imagine even 3 months back. Many of you might have noticed this as the finance minister was making her COVID relief package announcements. One of the things that she announced was this ability for states to borrow up to 2% of GSDP, and that was tied to specific reforms. And that included a focus on urban reforms. Again, something that we certainly could not have predicted. But I think, again, an example of a fairly sort of hidden issue almost, which people have been painstakingly working on for a number of years. But it suddenly gained salience and prominence in a way that would have been very difficult to predict even a short while back. So I think those are some categories of opportunities that we are seeing, Ingrid. I don't know if that framing is helpful, but technology-driven models, particular communities, and specific problems or issues. So that's on the first question. And the second question, in terms of sort of what lessons we are taking away and the ways in which we've been thinking of responding. You talked about our response through the Rapid Response Fund. Many people here might be familiar with it, but just to sort of cover it in 30 seconds, essentially what we were trying to do there is to focus on what we could do as a funder to bring some rapid response to people who are working on interesting projects related to COVID. And I think essentially what we tried to do there was to reinvent some of our existing processes. We realized that our existing grant-making processes would be too slow, too onerous to respond in a quick manner to what was going on and the need that we were seeing on the ground. Right? So what we did is to create a 10 crore fund and essentially completely change the way that we administer decisions on that fund. So we were actually able to disburse grants to about 65 or so organizations from that 10 crore corpus and do that in a matter of about 2+ months. So definitely, I think something that we feel quite proud of, but also
hope we see a few more donors start to emulate some of those practices. Coming to you, Ashif, when Sahas released the research study that you did, where you detected the problem earlier than most organizations because you saw this flood of calls coming in to your helpline. You then use the helpline to essentially get real data from migrant workers across the country of what their situation actually was. And in my living memory, the first time during a disaster, an organization was able to advocate to get a forgotten community on the radar when it came to the media, when it came to donors, when it came to the government. How did you go about it, Ashif? And what are your plans, more importantly, going forward to sustain this agenda over the medium and longer term?
Yeah. So first of all, thank you, Ingrid, for this opportunity to share our work with the migrant worker. Basically, if you see, like particularly in India, most of our community members or the government or the policy maker aware about the issue related to the migrant worker after first lockdown. Before that, the situation was same, like migrant worker face tremendous amount of discrimination, violence, exclusion, but nobody want to discuss about their issues. In India, very few organizations are working with the migrant workers at the source and destination. Some organization only focusing the source related work. Some organization are only focusing destination related work. So that kind of challenges was there actually. We started the pilot program from Bundelkhand to Delhi corridor about 2 years ago. And under that program, basically, like we try to use the technology for tracking of the migrant work. We initiated one process called LMT, Longitude Migration Tracking System. And basically, through that system, we track about 122,000 migrant workers. So in Bundelkhand, in average, about 1 million people from the rural Bundelkhand are migrating to the Delhi NCR area, mostly like the 80% migrants, and about 20% migrating to Maharashtra, Pune, and some other destination locations. The issues related to the migrant worker are very complicated at some level, because from the decade and decade, like the migrants are migrating from their source villages to the urban area, but no any powerful government like the policy and program is exists. We have very old one legislation called Interstate Migration Workmen Act. That act basically supposed to prevent the discrimination or exploitation of the migrant worker. But in India, only 0.5% government authorities, particularly like the Labor Department, is implementing that law. So 99.5% law is not implementing by any authority. Most of the time, like the district collectors or some other like the government officials are not very much aware about this law. And same thing with the private sector also. So nowadays we are discussing a lot with the private sector. So private sector is also not very much aware. And most of the construction companies and some other companies are violating this law, but they are not very much aware. And I think it's a issue of the negligence, but at the same time, people are not aware about the law. That's another like the issue. So that's a one thing. So basically, when the government of India announced the first lockdown, on that day, actually, within a 2-hour time, we received about 480 calls in our helpline. And we are running a nationwide like migrant worker helpline. So we received call and we were not able to handle that call. So next day, we appoint another 25 volunteers to manage the helpline. And we realized that a migrant worker like faced the various kind of challenges because of the lockdown. So on the next day of like the lockdown, we decided that we will initiate a rapid assessment, and we want to complete this rapid assessment within 36-hour time. So we put about like 80 volunteers. They call to the migrant worker, they collect all the information, and basically sometimes we say data. So I think data is a one thing, but emotions. So many people said कि साहब आपने फोन किया, मैं कोविड से कम मरूंगा मालूम नहीं, लेकिन अभी मैं भूख से मरने वाला हूँ. So I'm not aware कि what will be like the impact of the COVID in my health situation or in like the health situation of my family. But because of the hunger, because of the poverty, because of the like homelessness, these kind of issues are there. So basically we capture the data, but at the same time we capture the story and emotion or like the pain of the community. I can just add one point. As of now, we documented about 482 death cases of the migrant worker. So basically about 28% deaths because of the suicide. So these are the also very complicated issue. So we decided that we will complete the like this rapid assessment within 2 days, and within 1 week we release our first report also. And basically we share that report with the government, because many times when you say advocacy, so most of the people are thinking advocacy for the government. But we believe that the government is not able to solve this problem. Even though government allocate lots of resources, financial resources, lots of policy level changes. But I personally believe, and as an organization, we believe government is not able to solve this problem. We need very active involvement of the larger community also. Not only civil society, philanthropy or investors, but the communities also. And first time after our report, we discussed with the media people. And as of now, about 800 TV channels and newspapers took the finding of the report and they use for the multiple like the media reports or article. So I think the role of media is very important, again not for the government but the larger society also. So nowadays if you see the a migration issue not discussed by only like the civil society, but many other people like the student organization in WhatsApp groups. At many places people are discussing about the migration issue, and that's a very important to ensure policy level reform, like the allocation of the larger budget for the particular problem. So that kind of like the focus in our initial like the intervention. That's the one thing about the study. The second thing, we also discuss a lot with the philanthropies, with the civil society organization, with the government agencies, including like the Niti Aayog, including Labor Ministry and the other like the state level authorities, for example, like the BOCW board. So after the third day of lockdown, the Labor Minister said that we have like 35,000 crore rupees in our budget for the BOCW. But the next day, Finance Minister said, no, that's 31,000 crore rupees. So still some confusion is there about the budget, but we have more than 30,000 crore rupees in the BOCW says funds. That fund come from the industry, but industry is not very much engaged in the like the implementation of the BOCW funds or like the utilization or reporting or monitoring. So we also try to engage with the industry. You can play a very crucial role for effective implementation or effective use of the BOCW funds. But because many times, if you see the last 1 week media report, in many state, the state BOCW boards use BOCW funds for the like buying a car for the labor department. And that's not a labor welfare kind of thing. The labor welfare is a very clear cut like the definition mentioned in the BOCW Act. So we are just requesting that you can implement or you can use the money for particular purposes. As of now, about 1.5 weeks ago, Ministry released a one statement where they said that we utilize about 5,000 crore rupees for the like they made a cash transfer and some other activities. So that's a one thing. Government also like initiated another program for the migrant worker at the source villages, and that program called Jan Kalyan Rozgar Abhiyan in 120 districts, and government allocated another 50,000 crore rupees for implementation of this program. And we basically build a coalition of the 42 civil society organizations, how we can collaborate with the government at the district level, and we can ensure effective implementation of this program. So that's a one thing. When we say advocacy, sometimes we think advocacy with the government, but we always believe advocacy with the private sector, advocacy with the like the larger communities. One another point, basically, when you say migrant worker, so basically migrant worker is a like a very large like the definition. But within that, if you see the pictures, most of the time we like the media feature the one male member, and he is migrating from the village to the urban area for job. But about 20% women are also migrating. About 30% like the women family member are also migrating. They are not going for the work, but they are supporting to the family. That's also very important issue, and we try to like capture the issues related to the women migrant worker or women family members also. That's the one thing. We during the lockdown period, we documented many cases related to the rape and sexual violence also. And as previously we discussed, the criminal justice system, particularly like the courts, are not working very effectively during that period, because our courts are not very tech friendly courts. Recently, like the Ministry of Home Affairs announced to establish more than 1,000 e-courts at the district level, but it's still lots of like the issues are going on around the establishment of these kind of courts. Same thing with the police department. When the people went to the police station, police said, we are managing the whole like the law and order situation, so we will not take these kind of cases of the migrant worker, because many rape cases, gang rape cases we documented during last like 100-day period. So that's a one thing about the larger like the picture. I want to take another 2 minutes if you allow me, and I want to share little bit about our like the future plan. So basically, with the 42 civil society and the community-based organization, we formed a collaborative called Migrants Resilience Collaborative, and we try to solve 4 problems. One problem about the real-time tracking system of the migrant worker. because in India, recently Parliamentary Standing Committee says that kind of system is very important. World Bank also allocated about a $1 billion US dollars for that kind of social registry. So we are trying if we can establish a model where we can easily like register the migrant worker and we can track the migrant worker with the use of technology. So that's a very important component. So we try to like work. Currently we have a database of 1.5 million migrant worker, and that data we collected during last 100 days actually. So we believe that within a next 3-year period of time, we will collect the data of 10 million migrant workers at the source and destination. Second thing is about the social security and entitlement for the migrants. That's also a very important piece. As far as BOCW is concerned, that's a very important program for the construction workers. As of now, about 5 crore migrant worker or construction worker register in this like the scheme, but it's still implementation related challenge. Third is ethical recruitment. And for the ethical recruitment, we need support of the private, like the companies.
Amazing, Asif. We could spend the rest of the evening talking to these three panelists because each of them have so much more to tell us than we were able to squeeze into this time. Thanks again to Archana, to Bharath, and to Ashif. Your work has been amazing. Your sharing it with us is a real privilege. Thank you.